Or if you can you type in the chat to let so that I know you're here? Okay. And then Hương Đinh. So Jan, part of our activities require you to speak. So are you not able to speak at all? Okay. Okay. So for the first activities, please say introduce your name, your age, which year are you currently in school, and your hobbies. So I will start. My name is Kan Yao. I am 21 years old, and I am currently an undergraduate biology student at the University of California, Los Angeles. And yeah, I want to study and then apply to medical school, become medical students like all of you. And my hobbies is that I like playing piano, I like watching Korean and Chinese dramas. Okay, can I have Hugh go next?
Hi, my name is Yo, and I'm 18 years old. I'm studying at Thái Nguyên Medical University. Um, and I want to be a doctor in the future. I uh, I option playing game. I option play game in my free time. That's all.
Okay, thank you. Nice to meet you. Chào anh.
Hello, good morning, Vietnam. I don't know what time is it in USA. My name is Choang and I'm 18. I'm the first year medical student at Hanoi Medical University. And my hobbies, I like to play some musical instrument like piano and violin.
Wow, wait, I play violin too. I play when I was like not 8 years old, but I stopped practicing. Are you
I think
really?
it's really hard.
Yeah, it's hard. Okay. Um, I don't know if Jan and Lin, could you guys type in the chat or speak and like introduce yourself? Hmm. Could you guys speak? Okay. Um, okay, I will start then. And em biết nói tiếng Việt nên nếu mà không hiểu gì hay là không biết thì em sẽ chuyển qua tiếng Anh. Nhưng mà em sẽ cố gắng nói sẽ chuyển qua tiếng Việt nhưng mà sẽ nói tiếng Anh nhiều hơn để anh chị có thể học nha. Okay, before we start, make sure you have the vocab list, the interview guide, and the template report, as well as the empathetic phrase that I sent out. Do you guys have all of that? Please thumbs up if you have those handouts. Hugh, do you have them? Okay. Yeah, so these will be really important and really helpful for you guys. Okay, 1 second. So for this activity, please match the words to the definitions, and you since Châu Anh and Hugh can take turns. So Châu Anh, you can go first. Whenever you're ready.
I think A is matched with 4. The appendicitis is the inflammation of the appendix that cause pain in the right lower abdomen.
Yeah. Okay. Hugh.
Um, I think cholecystitis is matched with sick inflammation of the gallbladder, often caused by gallstone.
Mm-hmm. Yes. So inflammation of gallbladder. You can repeat gallbladder.
Gallbladder.
Yeah.
Gallbladder.
Yeah.
Yes.
Bladder, like the D, der. Gallbladder.
Okay. Gallbladder. Gallbladder. The.
Yeah.
Okay.
Yeah. Good job. And then Châu Anh.
Maybe C go with 1. The urinary tract infection is the infection of the bladder that causes burning with urination and frequent urinations.
Mm-hmm. Yes. Hugh. Two.
Ectopic pregnancy is the pregnancy that develops outside the uterus, often in the fallopian tube.
Yeah. Okay. Yeah. So you can say fallopian tube. Make sure you say the end of tube.
Tube. Fallopian tube.
Yeah.
Tube.
And then uterus. Uterus.
Uterus. Uterus.
Der. So the T is like a D. Uterus.
Oh. Uterus.
Yeah. Yeah. Okay. Next.
Pancreatitis is the inflammation of the pancreas that causes severe upper abdominal pain radiating to the back.
Yeah. So it's pancreatitis.
Pancreatitis.
Yeah. Yeah. So you notice a lot of this with the T. Americans pronounce it like a D. So pancreatitis. You're what is it? Yeah, or appendicitis.
Pancreatitis and
Yeah.
appendicitis.
And then last one.
Diver diverti diverticulitis 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 is the inflammation of small bowels in the colon that can cause left lower abdominal pain.
Yeah, so it's diverticulitis.
Diverticulitis.
Yeah. hmm And then, so inflammation.
Inflammation.
Or,
Inflammation.
wait. Yeah. Of small pouches.
Small pouches
Yeah. In the colon.
in the colon
Yeah. That can cause
that can cause
left lower
left
lower. Yeah.
lower
Yeah. Abdominal pain.
abdominal pain.
Yeah. Yeah. That's it. Thank you. Yeah, so you guys got it all correct. So appendicitis is inflammation of the appendix. Cholecystitis is inflammation of the gallbladder. And UTI or urinary tract infection is number one, which is infection of the bladder. Next is ectopic pregnancy, is pregnancy that develops outside the uterus. And then pancreatitis is inflammation of the pancreas. And lastly, diverticulitis is inflammation of small pouches in the colon. So, good job. Okay, next part is right here. Yeah, so this is you will given these conditions, you will tell me which quadrant or location of the condition. Um, Hi, Ding, are you able to talk? Ding, are you able to talk? Or type in the chat? Give me 1 second. Okay. Yeah, so for this activity, um, please refer to your pain locations and cost of the vocab list, and it will help you a lot. So please have them open and then give me a thumbs up when you're ready. Joanne and Hugh, can you guys give me a thumbs up when you have the vocab list and go to pain locations and causes? Okay. So, Joanne can go first. Please give me the location of appendicitis.
With appendicitis, I think it's happened at the right lower quadrant.
Give me 1 second. right lower quadrant is correct. And also, some may answers can repeat or some may not be used. So, yeah. Next for cholecystitis. Hugh?
I think it's as the upper mid epigastric
Cholecystitis? Um, yeah, check the vocab list again.
oh,
Do you have the pain location and causes open?
I think that right upper quadrant.
Yes, correct. And I can help you say the word again. Cholecystitis.
Choly, can you re- repeat?
Yeah, cholecystitis.
To remix something effectively, you can reorder, layer,
Cholecystitis.
Cystitis.
Cystitis.
Yeah,
Cholecystitis.
yeah. Sorry, oops. Don't look, sorry. Okay. Okay, for next for sorry, urinary tract infection. Chào anh.
I think urinary tract infection happen at the suprapubic.
Supra pubic.
Supra, yeah, pubic.
Yeah, yeah, that's correct. So supra pubic. So lower middle of your belly area. So lower middle. Yeah, good job. And Hugh.
I think ectopic pregnancy is lower middle.
Mm-hmm. Do you know the vocab for that?
Is the pregnancy growing outside the uterus?
Oh, no. Like you said lower middle, right? We have a vocabulary word for that.
Oh, okay. Um,
Like, yeah, like right here.
supra suprapubic.
Yeah. So supra pubic. Pubic.
Suprapubic.
Yeah. Oh, and then Dean, could you do pancreatitis? Oh, you can't talk. Okay. Can you type in the chat? Epigastric. Yes, correct. So epigastric, which is correct, is upper middle. So suprapubic is lower middle, and then epigastric is upper middle. Good job. And then Zhao An, you want to do the last one?
Diverticulitis. I'm not sure about this. I think it's happened in the maybe the right lower quadrant.
Left lower quadrant.
Right lower quadrant.
Yeah, I would say it's could be any lower, but or at least for us, the answer is left lower quadrant.
Oh,
That's what it says in the vocabulary list. Yeah. Like, sorry. You guys have like this part, right? Like this vocabulary list. Yeah, thumbs up.
yeah.
Yeah. So, in the right column, it says that diverticulitis happen in the left lower quadrant. Yeah, but yeah, you're correct. Okay, thank you. So yeah, here's the answer, and good job. So then, next for part 3, please. These are some tests or procedures for abdominal pain. So please, in simple terms, explain what the test is or the treatment is, and give me a reason why doctors use it. Like, what does it? Why does it? What does it test for? So, again, go to your vocab list, and then go to imaging studies, and then common treatments and procedures. Thumbs up if you have it ready. Yeah. So go to your vocab list and then scroll to imaging and common treatments and procedures. And then I'll help you. Hugh, you got it? Yeah. Okay. And Thing, do you have the list ready? Yeah. Danny, can you check the chat if he responds?
Yeah, he says he has it.
You wanna lead this one?
Sure. All right.
Mm-hmm.
All right, Hugh, can you tell me what the CBC is? Or the first one? Can you read it and then tell me what it is?
Simply CBC, corporate
Yeah.
blood count.
Yeah.
It helps the doctor check the red cell, white cell, and platelets. Platelets.
Yeah,
I
that's
don't
correct.
know.
And then when would you order one? When would you get a CBC?
When the doctor want to know the information about the infection, inflammation, bleeding, anemia.
Yes, that's correct. Thank you.
Anemia.
Yeah.
Yeah. So
And
the it says platelets.
Uh,
Platelets.
platelets. Platelets.
Platelets. Yeah.
Okay, thank you. Ma-
and then Dawan, could you read the next one and then tell me what it is?
The CT scan help us show the detailed X-ray imaging, often with contrast, to give us a detailed picture of our abdomen.
Mm-hmm. And then what is it used for? Like what conditions?
I think this can use for appendicitis, diverticulitis, obstruction, and stone.
Good job. Thank you. Thank you.
Yeah, so I think you said it would be abdomen. Abdomen.
Abdomen.
Yeah,
Abdomen.
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 Yes. Okay.
Let me
And
go to the
then,
next slide.
oh yeah.
Sorry, it's like lagging. Oh,
Oh yeah.
nope. What the heck?
KG, can you look at the chat really quick? Oh wait.
I can't. Sorry. Let me go back to the slides. What did it say in the chat?
Nothing.
Is my screen lagging?
Yes, you're on the Daniel Kim slide. Oh wait. You're okay. You're on like all the way back at the vocabs.
Okay, sorry.
You're on part two. So like one more time.
Okay. Oh. Denny, can you text the metal TH chat to feel free to do multiple scenarios if they have less students?
Okay.
Okay. Okay, sorry, my screen lagged a little bit. Yeah, so these are examples that you guys can look at. And then yeah, next one. You can thing. Can you type in the chat of what abdominal ultrasound is and why do the doctors do it? So thing says an ultrasound uses sound waves to create images of organs in the abdomen, and we use it to check the organs. Let's see. Wow, that's correct. So it says scan uses sound waves to create images of organs, and doctor use it to look at like gallbladders and detect gallstones. Good job.
Then Hugh, can you read the next one and then tell us what it is and why do doctors do it?
Urinalysis is is a test when the doctor wants to know if the patient is infectious. Also, it is used when the doctor wants to check their blood crystal in the urine. Then,
Yes. Oh yeah, sorry, keep going.
when the 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 doctor want to order it when they want to check the patient UTI, kidney stones.
Yeah.
Yeah, and for that word, I would just like work on like the beginning of it. So urinalysis.
Urine analysis.
Yeah, and then the other word infection. infection?
Infection.
Yeah, but besides that, your answer is like completely right. So good job. And then Dawan, did you want to read the next one and then tell us what it is and why did the doctors do it?
With a pregnancy test, the doctor can check the pregnancy hormone that can help them to rule out the ectopic pregnancy.
Yeah, that is correct. And then KG, did you want to say something before I cut you off earlier?
Oh no, I think just
Okay.
hormone would be hormone.
Hormone.
Hormone, yeah.
And then did you want to type what lipase blood test is and why did the doctors do it? And then I'll look at the chat for that.
Wait, Joanne, did you introduce yourself earlier? Or did I skip you?
Oh, me?
Yeah, did you introduce yourself earlier?
Yes, I did.
Maybe I forgot.
The vowel.
Oh yeah, the vowel. Okay.
All right, Thing says a lipase blood test measures the level of lipase, an enzyme from the pancreas, and it is used to help diagnose pancreatitis. Then KG, can you go to the next?
Mhm.
And yeah, that's pretty much what it is. It's a blood test that measures an enzyme from the pancreas, like you said, and high levels suggest pancreatitis, just like you said. Right, good job.
Okay, so for this patient interview, we will each student. So Ding, Joanne, and Hugh, you will be assigned each patient, or the TAs will be the patient, and please have the interview guide ready, and you will ask us questions based on that, and then we will act as the patient and respond to you. So, thumbs up if you have the interview guide ready. So, it should look like this. Thumbs up if you guys have it. Yeah? Okay. Yeah, so just follow this, and all three people, everyone here should take notes, because even though like one person is asking question, I want everyone to take notes of like key information that the patient shares with you, and I will stop throughout the interview to ask someone else a question about what they heard. So everyone have the guide ready and another like paper to write down notes. Yes? Okay. What one? Yeah. So Thing, since you can't speak, um, I'll have I won't give you a scenario, but whenever I stop to ask the questions about what you heard, please type in the chat, okay? Okay. So let's say Hugh, can you be I will be your patient and you will be asking me questions, okay? Okay. I'm ready. So imagine I just walk into your room for an appointment. Doctor, can you help me, doctor? What is your name, doctor?
Hello, my name is Hiếu, and I will be your doctor today. Can you please tell me your name and date of birth?
My name is Maria Hernandez. I am 24 years old. I was born on March 14, 2001.
Then what brings you in today?
Um, Give me 1 second. Um, I've been having abdominal pain. Um, it started last night and it's getting worse.
Can you tell me more about the abdominal pain you have been having?
Yeah, it started last night and it just kept getting worse today.
Then did did it start suddenly or gradually?
Um, it started gradually.
Then what were you doing when it began?
Um, I was studying at home.
Then where exactly is the pain?
Um, it's mostly on my lower right side of my belly. On the lower right side.
Then is the pain constant or does it come and go?
Um, it's constant.
Then how would you describe the pain?
Um, like it feels sharp.
On a scale from 0 to 10, how bad is it?
Mm, it's about an 8 out of 10.
Then does the pain move anywhere else?
Um, it's just near. Let me see. It's just near my right lower abdomen. That's it. No back, no shoulder, nothing.
Then the movements or bending of face,
Could you repeat that?
those movements or bending of face,
No.
then had you tried anything for it?
Um, Actually, walking and moving makes it a little worse. And I haven't eaten anything because my belly hurts so much.
Then Do you feel nauseous or have you vomited?
Um, so let's pause for a little bit. Um, I want to ask Thing, can you tell me 2 to 3 details you heard about the patient's abdomen pain? Danny, do you know who's in the main room?
In the main room, it just says it's the metal.
Because there are some students just enter the waiting room. Thing, or do you have 2 to 3 details you heard?
Oh, I think he joined Veronica and Jenna.
Okay. Okay. Increase when moving. Jawan, do you have any other details that you heard?
Can I say or chat or have a chatting?
Huh?
Can I say or I have to chat in the
Oh,
box
you can
chat?
say it. You can speak.
Okay, I know her name. She's 24 years old and she have an abdominal pain at the lower right quadrant. This happened last night and it's become worse. But gradually pain when she's studying at home, and the pain is constant. It's 8 out of 10 and is sharp. The pain didn't move anywhere else. It's become worse when working and moving, and she haven't eat anything because it hurts so much.
Wow. Wow. That's a lot. Thank you. Okay. Hugh, you can continue. I think you were asking about nauseous or vomiting, right? Okay. Can you ask the question again?
Do you feel nauseous or have you vomited?
Yes. I feel nauseous and I vomited once today.
Um, have have you have you noticed any change in your bowel movements?
No, but I have a little fever. I can poop normally, though.
Oh, then, have you noticed yellowing of your skin or eyes?
No.
Then, do you have heartburn or acid reflux?
No. No heartburn. No acid reflux.
Do you have any medical conditions?
Um, let's stop right here, and then I'm gonna ask. I'm gonna ask Joanne, or let's ask Thing first. Um, Did you hear any symptoms that the patient say? Tell me any new symptoms you heard. Okay, thing says patient has no nausea or vomiting. I think the patient did say they are nauseous and vomit twice today. Or vomit one time today. Yeah. But so let's say Joanne, do you hear anything else?
I think she felt nauseous and vomits one today. Also have a little fever, but she breathed normally.
Yes. So yeah. So fever, nauseous, vomit one time. Okay, Hugh can continue.
Do you have any medical conditions?
No.
Have you ever had stomach, liver, or gallbladder problems?
No, I don't have any stomach, liver, or gallbladder problems. I don't.
Are you taking any medications?
No, I'm not. Actually, I did take some pain and fever medications. Sorry, I forgot.
Um, do 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 you smoke?
No, I don't smoke.
Do you drink alcohol?
Sometimes, like once a month.
Do you exercise regularly?
Um, I haven't. Yes, 2 to 3 times a week.
Have you had surge or worsening pain?
Okay, we'll stop right here,
Uh,
and I'll ask Thing again. Um, what risk factors like the history or medical history, medication or allergies, or social history do you have? Did the patient say? So give me some details you heard. Okay. No gastritis before. So correct. The patient said that um, she did not have any stomach, liver, or gallbladder problems before. So correct. Jawan, can you tell me some history, medication allergies, any history the patient has?
She had some pain and fever medications and no no problem with stomach, liver, or gallbladder. She doesn't smoke. Sometimes she drink alcohol once per month and exercise 2 to 3 times per week.
Yeah, good job. Okay, continue. Hugh?
Has the pain affected your daily activities?
Um. Oh, I think you skipped. You should ask about the red flags.
Mm,
You were asking me about is the pain severe or worse, right?
I noticed it is the same with the battery associated symptoms.
Associated symptoms.
Uh, The question
Uh.
is the same.
Oh,
I think.
one. Okay. I think you can start. Oh yeah, it is the same. Let me see. Yeah, you're right. Okay. You can ask the so. No. Yes, it's affected my activities. Um. Yeah, it's like hard to move around. I'm just like lay in bed all the time. I can't sleep or go to work normally.
What do you think might be causing the pain?
I'm not sure. Something I eat, maybe?
Is there is there anything you are particularly worried about?
I don't know. I'm just worried that it might be something serious. I just hope the pain will stop.
Is there anything else you would like to tell me?
No.
Then thank you for coming today.
Thank you. Okay. Um. Yeah. So, should we go to the next one, Danny, or should we do the optional discussion?
You can ask like one or two of the optional, like maybe what the diagnosis could be or like what organ systems.
Hmm. So, this is question is for anyone. What do you guys think it could be? What like important details do you think? So it's okay. You can just guess later when I ask for a complete summary report. But yeah, so some major thing to note is it's in the right lower quadrant. There's nausea, there's vomiting, there's a fever. The patient can't eat, so a loss of appetite, and it worsens with movement. So yeah, so Hugh, good job. Um, oh, good thing you like know which questions you repeat already. So I think that's good that you catch that. Um, any any critiques, Danny?
Uh, no, not too many. Like just what you said, like maybe using some more of like the empathetic responses here and there. Like the patient mentioned like the 8 out of 10 pain so you could like say something like, oh wow, that must be sound like really painful, or we're trying to help you with that, and like does anything, and then like use that to segue to like your next question. Like like you say that and then like, oh, is there anything that makes it feel like better or worse? So just like if you can like implement those like in between questions.
Yeah. You have the empathetic phrases document, right?
Yeah.
Yeah, so next time you can try to say those sentence after a patient tell you, especially like, oh, it hurts like a lot, or it's a 8 out of 10 pain. So then you can say like, oh, okay, sorry you're feeling like that, or I wish I could help, or yeah, say sentences like that to help the patient feel better. Yeah.
Yes. Yes, I
Because
will.
Because in real life, we don't want to be like, okay, next, right? Okay, Zhao An. So, so keep your notes there. Later, I will ask you to generate a summary template. Okay, next is Danny can guide this patient, and Zhao An, you will be asking questions, and Hugh, as well as is Ding still here? Danny, is Hugh still there? Or Ding still here?
No, I don't think
No.
so.
Oh,
Yeah, I think it's just the two of us. Or the two of them and the two of us.
okay. Jawan will be the next, and you can be patient number
All
2.
right. Okay, so I'm a patient. I just entered your office or your clinic. Hey, hi, doctor. And
Oh,
then you can,
hello.
yeah, you can just introduce yourself.
Okay, so my name is Choi and I'll be your doctor today. So can you tell me your name and date of birth?
Yeah, my name is Robert Johnson, and my birthday is July 8th, 1973. I'm 52 right now.
Oh, so what brings you in today?
Yeah, I've been having pain in my abdomen.
Okay, oh, it feels so bad. So when did it start?
It started about 3 days ago.
It start like suddenly or gradually?
It started suddenly after dinner.
Hmm. What is related to eating? Maybe because it happened after dinner or exercise or movement?
Uh, yeah, it happened like right around when I just finished eating, and it usually happens after I eat.
Oh, okay. So, can you point to where it hurt the most? Is the upper abdomen, lower, or near your belly button?
Yeah, it's like on the upper right side of my abdomen.
Okay, so is the pain constant or does it come and go?
It comes and goes.
And how long does each episode last?
I would say about 30 45 minutes each time.
You have the pain 3 days ago, right? Has this been
Yes.
happening every day or just some?
Yeah, I would say it's been happening like every single day, especially after meals when I eat.
Oh, it sounds so uncomfortable. How would you describe the pain? Is sharp or dull?
It feels like a strong squeezing pain.
Oh. On a scale from 0 to 10, how bad is it?
I would say it's about a 7.
Has the pain getting worse or just stay the same?
It's been getting worse.
Okay, so it's happened after you have a meal, right? So is the pain severe enough to wake you from sleep? I hope no.
Uh, yes, just once though, just last night.
So does the pain move anywhere else?
Yes, it sometimes goes all the way up to like my right shoulder and my back.
Okay, so how many times this happen a day?
Uh, I would say every time I eat, so about 3 times a day.
Hmm. Is it worse at night or in the morning, or it depend on how much you eat?
Yeah, I think it depends on how much I eat. I think like usually if I eat more like at during the nighttime, it hurts more then.
Okay, so uh, if you eat more, is make it worse or anything else?
Yeah, eating more makes it worse, or eating like fatty foods like fast food. I think that makes it a lot worse.
Oh, okay. So is there anything make it better?
I think like sitting or like resting helps it a little bit.
Have you tried anything else for it?
Yeah, I tried like antacids and then like indigestion medicine, but it didn't really help.
What kind of medicine you take? You took?
It was my daughter bought it from the store. I wasn't sure, but she said it was indigestion medicine.
Okay. Do
And
you
then
feel? Yeah.
oh sorry, I'm just gonna pause right here. And then I'll just ask Hugh a quick question. Can you tell me 2 to 3 important details you heard about the patient's abdominal pain?
Me, right?
Oh, Hugh? Yeah.
Um, his name is Robert Johnson, and
Yeah.
his pain started 3 days ago.
Mm-hmm.
It started suddenly after his dinner.
Yes.
Uh, it was at the upper right side abdomen. It uh, come and go, come and go child of hers, and it lasts 30 to 24 minutes each time. It it strong squeezing pain, and on a scale 0 to 10, it 7 out of 10.
Yes, good job. That was like most of it. Yeah, you took good notes. Good job.
Good job.
All right. Sorry. Yeah, Dawan, you can continue asking the questions.
Okay. So do you feel nauseous or have you vomited
Yes, I do feel nauseous, and I vomited once.
once per day or once
Uh,
since 3 days?
just one single time within the last 3 days.
Okay.
Just
Do you want to tell me anything more?
no. I just vomited once yesterday, but I've been feeling nauseous throughout.
Is there any fever or chills?
Yes, I had a mild fever yesterday.
So any diarrhea or constipation?
No, I would say like my bowel movements have been pretty much the same. No changes there.
Any have you noticed any blood or like the color of your stool is not normal?
No, looks normal to me.
Okay. Do you feel like bloating or loss of appetite? Okay,
Yeah, I don't feel like eating as much because I feel like it just hurts.
okay. Uh, do you have uh heartburn or acid reflux?
Yes, sometimes.
Heartburn or acid reflux, please.
Uh, Acid reflux.
You have it like often or just sometimes in a day?
Yeah, I would say like every so often.
Oh, that's so bad. Uh, any difficulty swallowing?
No.
Okay. So, you have like digestion medicals, right? You like take it to the store. Have you ever
Y-
had, yeah,
oh yeah, I was just gonna say like just like I don't usually take the medications. I only bought it because of this.
okay. So, have you ever had stomach, liver, or gallbladder problem?
Uh, Sorry, one second. My doctor told me I had gallstones a few years ago.
So, have you had any surgery with it?
No, I've never had any surgeries.
Oh, okay. Uh, so do you smoke?
Yeah, about half a pack a day.
Do you drink alcohol?
Yes, a few times on the weekends.
So, how would you describe your diet? Do you usually take like fatty thing and fast food?
Yeah, I would say I do eat a lot of fried and fast foods. Uh, because I don't have as much time. Like they're just quicker and easier. But yeah, I think it's a problem. Like I have high cholesterol, so I think it is like a problem because of that.
So, do you exercise regularly?
No, not as much as I would like to now.
Okay.
And then just really quick, Hugh, what risk factors does this patient have? Or what past medical history does he have? Past medical history or social history?
Um, he smoked and drink alcohol few times in the weekend. He eats the fast food because he doesn't have much time, and he doesn't do exercise regularly.
Hmm. Yeah, and then do you remember what symptoms that the patient said he had earlier?
He don't have.
Oh yeah, no worries. It was like a while ago. So he said he felt nauseous and he vomited, and then he said he
Oh,
had acid reflux.
he had some minor fever
Yeah,
yesterday.
yeah.
He don't have any diarrhea or constipation.
Hmm.
No diarrhea or constipation.
Yep.
Did Joanne ask about the yelling of eyes or
Oh,
bloating?
Yeah, so I'll just like go back and say like, yeah, the patient did have yellowing of eyes, so that's like another note.
Yeah. So yelling of eyes.
Yeah.
Joanne, you should ask about like um their poop. Like, is it
Oh
their
yeah.
stool? It's dark.
There was no blood, no diarrhea, but there's pale stool, and then the urine is a little darker. Yeah. Yeah. So those were all like the symptoms. So it's just
Oh,
like those two at the end.
I forgot to ask that.
Oh yeah, no worries, no worries.
Okay. So,
Okay.
has the pain affected your daily activities?
Yeah, I think like eating is a lot worse. I think going to work is a lot harder too. And then like yesterday I said like it was a little harder for me to sleep, so that made work a little harder because I was more tired.
Okay. So what do you think might be causing the pain?
I had gallstones in the past, so I'm worried it might be related to that again.
Okay. Is there anything else you'd like to tell me?
Yeah, I'm a little worried that it could be something serious and like I want to know, I really like want to know like what's causing the pain and like how I could treat it.
I hope that we can help you. I think that's all.
Okay. And then just like for both of you, based on the history, what organ systems do you guys think might be involved? And then like what is a possible diagnosis that you guys might be thinking of?
And this is hard. You guys, are you
Yeah.
guys, which year are you guys again in medical school?
I'm at
Yeah.
first year, so I think I'm not
Yeah.
ready to show it.
Yeah.
Yeah, so like organ systems, like, generally it's like the gallbladder, probably, and like the hepatobiliary system. And then the clues were like right upper quadrant pain, pain after like fatty meals. It kind of radiates to the shoulder and the back. Nausea, vomiting, fever, yellow eyes, and then the dark urine. And then the possible diagnosis could have been the gallstones again or cholecystitis. Yeah. But that last part was just kind of like a little extra part. So no worries if you couldn't figure out the diagnosis. Okay.
So yellow eyes, pale stool, and dark urine usually suggests like liver problems, or and yeah, it is often related to gallstones or cholecystitis. So I think I didn't tell Hugh for the first patient. Um, yeah, let's go back to the first. So usually it involves like the gastrointestinal system. What does that include? Which organ is that? You know what I mean? That's like, okay, let me see. So give me 1 second. What's in the GI system, Denny?
Like gastrointestinal, like
Yeah.
all the digestive tract, intestines,
Yeah. So um
appendix.
yeah. So for Hugh, so some of the clues was that, oh, right lower quadrant, right? Nausea, vomiting, a fever. Um, the patient doesn't eat a lot, loss of appetite, and so a possible diagnosis is appendicitis. Yeah. So and if you ask the doctor, they might like um, have a abdominal scan, or they can do like the surgery, the appendectomy, where you remove the appendix. Yeah. Do you need me to repeat any of that? No. Okay. Yeah. So gather all your notes, and then we'll create a little template. Sorry. So you have the template document too. So this one, and then scroll to the bottom. There should be this paragraph. So put all your information into this paragraph, and then in a bit we'll ask you to share with us what your case report is. Okay. Can you fix it? Oh yeah, give me a thumbs up when you guys are ready to give the report. Well, I'll give you guys about a minute and you can share the report. And yeah, it doesn't have to be perfect. And if you're missing any information, Danny and I will help you fill in the information.
I think I can start it now.
Okay.
So, this is a 52 years old man with a history of gallstone, who present with abdominal pain at the upper right quadrant. The symptoms started 3 days ago after dinner and are described as suddenly strong squeezing with a severity of 7 out of 10. The pain is located at the upper right quadrant and may radiate to the right shoulder and the back. The pain is worse with fast food and when he eats more, and improve when he's sitting and relaxed. Associated symptoms include nauseous. He vomited once, mild fever, yellow eye and pustule, loss of appetite, darker urine, and often as he often had acid reflux. And the patient denies diarrhea and constipation. Relevant past medical. He had some digestion medication at the store. About his social history. He often smokes about half a pack a day, and sometimes he drink at the weekend, a few times at the weekend. He eats a lot of fast food, with high cholesterol, and he doesn't exercise regularly.
Okay, that was pretty good. Just few notices is like for like what makes it worse. Like I know the patient said fast food, but typically you want to be like more general and like say like fatty foods. And then for the past medical history, remember that he said he had gallstones before. And yeah. And also like you don't have to, but like usually at the end like maybe say like oh what you think it might be and like what evaluation you would think to give. So like let's like for example like overall presentation is concerning for gallstones or cholecystitis, and further evaluation may include liver function test or like an abdominal ultrasound. But yeah, everything else is pretty good. You got like all the information right.
Thank you.
Yeah.
Thank you so much.
Oh, and also during the interview, I think I heard you say like, "Oh, that's so bad." So I think um like the patient would probably want to hear like, "Oh my god, you think it's bad too? I'm scared." So you should probably be like, "Oh, like okay, it's okay. Like, well, I'll help you figure out something to help you feel less pain or something."
Yeah, I think that's like a little hard because sometimes like you want to be like, oh, that sounds painful, right? To like kind of like agree with them and make them feel heard. But sometimes like, oh, that sounds like let's say like you say I'm not saying you say this, but like an example would be like, oh, that sounds awful, right? It sounds like, oh, you think it's like bad? Like, am I gonna die? So like kind of like agree with them and like, but don't make them think that it's like bad or worse.
Yeah.
I will
Yeah.
try next time. I think
y-
It can
Oh no,
be.
you did good. That was just like an example, but I think that's like typically like pretty hard.
Yeah. Yeah. I don't like. I know some doctors are like, "Oh, that's horrible." Like, ugh, that's just make the patient feels worse. So yeah, just don't be too like positive. Like, oh yeah, yeah, it'll be like it's nothing. It's gonna improve. But don't be too like, oh, that's horrible either. So just a balance. But good job. I noticed you use a lot of empathetic phrases. Okay, Hugh, you can go.
The patient named Maria Hernandez. She is 42 years old. She had an abdominal pain last night when she is studying at home. It started gradually, mostly in the lower right side on her belly. It's constant and sharp, and and the heart feels sharp. Um, Working and moving make it worse, and she haven't eaten anything yet. She feel now nauseous, and she vomited one time. Also, she also feel a little fever. She uh she tried some pain and fever medication. She doesn't smoke, and she drink alcohol sometimes, like two, 2 to 3 times a week. The the hurt were really bad, so he lay in her bed all the time. She cannot walk around.
Is that it?
Yeah,
Yeah.
he-
Wow. You got a lot of the main symptoms. Yeah, like the pain and fever medication. Um, so just really quick, we usually end with here in the chat I put. So you want to add something like, okay, overall, what you think the diagnosis is. So it might be acute appendicitis, and further evaluation include a physical exam, blood test, imaging such as ultrasound or CT scan. So that's all. Yeah, so good job with everything, and that's just like the last two things that you should include. So diagnosis and what other procedures, treatment you might do in the future. Yeah, wow, good
Oh wait,
job.
sorry. How old did you say the patient was at the start? Oh wait, just like what was the first sentence you said?
Um, the patient name is Maria Hernandez.
Oh yeah, yeah.
Right?
Yeah. How old did you say she was?
Did you have an age for her?
Oh wait, I'm just like making
Yeah,
sure.
yes. I said she is 42 years old.
Oh yeah, so the patient is 24.
Oh,
Yeah. So that's just a
I
small thing, but yeah.
yes, I misheard it.
Yeah,
I'm
Yeah, no
sorry.
worries. You did
yeah,
good. You did.
yeah. Born in 2001, so 24.
Yeah.
Yeah. Okay. Yeah. It was really nice teaching you and Zhao An. You guys did a great job. So again, I would just say more emphasis on like empathetic phrases. That's really important. Like you guys are good at asking all the questions, but as a doctor patient, we want to make sure they feel comfortable too. And that's why all the empathetic phrases come in. Yeah, I think breakout room will end soon. Yeah, so I hope you guys learned, and I hope we were helpful today. See you guys next week.
Yeah, thank you guys. You guys did a great job today. All right, bye.